Nearly 10% of the US population suffers from diabetes, and that number's climbing each year. Diabetics are constantly drawing blood to check their blood sugar or glucose level. Diabetes can also cause major complications for patients needing surgery, landing diabetics in the ICU. One University of Miami scientist is using biomedical engineering to help diabetics in the operating room and the living room. Dr. Sylvia Daunert wants to help diabetes patients that are sick of the finger prick.
There is always the need to think about, do these patients have to prick themselves so many times a day to make sure that they are okay?
She says current glucose meters work fine, but it's time for something new. In research published in ACS Chemical Biology, Daunert and her team created a designer protein. But this is far from a fashion statement. Daunert changed the genetic code of a protein that senses glucose in the body. She modified it, adding synthetic amino acids to give the protein better sensing capabilities and a longer life. Constant glucose monitoring is difficult because sensors eventually succumb to high temperatures inside the body and don't do well in the cold either.
Even the best sensors don't last but a couple of days.
Daunert put her designer protein on a fiber optic probe and tested it at various temperatures. Her protein not only holds up better, it also kicks out more accurate glucose readings. The goal is that monitoring is also continuous for as long as the probe is in the body, something doctors have been clamoring for.
There are no continuous monitoring glucose devices that one can use, say, in an intensive care unit or during surgery.
Daunert's research is a big step, but it doesn't mean diabetics will be skipping the blood tests just yet. The first stop, she says, is the operating room or an intensive care unit. But she says thanks to rapidly improving technology, consumer devices that allow for constant glucose monitoring aren't far off.
We can use our biosensors that we just developed and reported, and in fact, look at our iPhone and look at the levels of glucose that we have. So this 20 years ago was impossible.
Daunert says she's grateful her research comes at a time when science and technology can bring relief and hope to patients everywhere.
For us, it's a great time to be a scientist.
Breakthrough Science is produced by the American Chemical Society. To stay up to date on all the latest, greatest research, why not subscribe to ACS?